My project proposal for Nursing 7220 is prevention of perinatal group B streptococcal disease, testing at 35 to 37 weeks gestation, and upon arrival to labor and delivery. Currently, the standard of care for detecting and treating and preventing neonatal group B strep disease calls for the mother to be treated at 35 to 37 weeks gestation by a vaginal or rectal swab for culture. They do this because group B strep is the leading cause of infant mortality and serious neonatal infections such as sepsis, pneumonia, and meningitis. For this reason, it is very important that group B strep be identified in the intrapartum period and/or prior to delivery. Early detection and treatment of group B strep at the time of labor and delivery would decrease infection to the neonate and the newborn, which would have a significant impact on patient care and decrease the rate of infant mortality. So my PICO question is, will testing for group B strep upon admission to labor and delivery prevent early onset group B strep disease in newborns instead of only screening at 35 to 37 weeks gestation? Some information about group B strep in infants less than 7 days old is it is the leading cause of illness and death among newborns. Usually, approximately 1,600 illnesses and nearly 80,000 deaths occur annually. For those infants that do acquire group B strep at birth, have long-term developmental disabilities such as mental retardation or hearing and vision loss. There was a study done in 2009 that found that 61.4% of full-term infants born with group B strep disease were born to women who had previously screened negative during their 35 to 37 week gestation visit. Back in the 1980s, studies showed that administering antibiotics during labor to women at risk for transmitting group B strep to their babies could prevent disease in the first week of life. After that study, in the 90s, prevention activities increased by doing more testing during that 35 to 37 week gestation. Then in 1996, recommendations were made for intrapartum prophylaxis to prevent the group B strep that was identified. The mother would be given antibiotics during labor and delivery to prevent the transmission of group B strep.